Good evening, everyone. Welcome to the third session of Delaware Mini Medical School Late Fall series that we're delighted to be doing in collaboration with BB Healthcare. This particular go around, you can follow us at delawareminimed.org, and a couple of you have emailed wondering where are the past presentations and videos. That's where you need to go for those. And then also we do this in partnership with the Sussex County Health Coalition, and you can visit them at sussexcoalition.org. As I already mentioned, we're streaming on YouTube. The direct link to this stream is in the chat. Remember that this is a Zoom webinar, not a Zoom meeting. You don't see each other. We don't see you except for your names. We only use the Q&A feature. We don't do the raised hand, and we don't use the chat feature except when we are communicating to you. To remind everybody, Valerie St. Bernard has a raised hand. You might see that. That is an artifact of her having gesture recognition turned on, and for some reason we can't figure out how to turn it off. So we love you, Valerie, but we are going to ignore you. Remember, when it gets to the Q&A, don't ask questions of a personal nature or about your family. If you do ask a question like that, we will attempt to generalize it in such a way that we de-identify who it is. To the best of our ability, all questions will be addressed between the end of the presentation and 8 o'clock, at which point we do end. Christy and I will be handling the housekeeping questions. And if we have a lot of PT related questions, because this is on physical therapy tonight, if they're fairly easy ones and we've got a lot of questions, we may field them in the background and leave the really meaty ones for our presenter. And just to remind you that you do need to stay through the entire presentation in order to be counted as present for this evening if you're going for the signed certificate. And but once the Q&A starts, you can leave. So at this point, I'm going to turn it over to my colleague, Christy Handley with the Sussex County Health Coalition to talk about them and also introduce this evening's speaker. Christy?
Evening. Thanks, Tim. As most of you know, I am Christy Hanley with the Sussex County Health Coalition. And really quickly, because most of you have been here for a few weeks, we are a coalition that engages our communities and makes sure that their voices are heard in some of the areas or health issues in our community. And we bring awareness to that to make sure that they're being heard. And next slide. So tonight's presenter is Joe Skocypec, and he is joining us from BB Healthcare. He joined BB in 2016 as the Director of Rehabilitation Services. He oversees the inpatient, outpatient physical therapy, occupational therapy, and speech therapy services. He received his BA in Biological Sciences from the University of Delaware and his doctorate in physical therapy from University of Delaware. His experience includes private practice outpatient physical therapy directly out of college, and he served in several clinical roles, including clinical director for several of the clinics that he was working for. And I'm going to turn it over to Joe.
Great. Thank you, Christy and Tim, for the intro. I'm going to just go ahead and share my screen here so we can get the presentation running. And if I could just maybe get a thumbs up and make sure it's okay.
You're good.
Good. Great. So welcome everyone this evening. Again, as alluded to, my name is Joe Skocypec. I'm currently the Director of Rehab Services at BB Healthcare. Been there for about 10 years now. And like Christy alluded to in the intro, I oversee our inpatient and outpatient PTOT and speech services. So we provide care at our main hospital. We have a short stay surgical hospital, and then we have 5 outpatient clinics throughout Sussex County where we provide care. So the presentation I'm going to deliver this evening is actually an APTA presentation that I've used before that I really like because I think it gives a great overview to students of all levels about the profession and the various areas which we'll get into over the next hour or so. And honestly, from a personal level, I wish this was a kind of a presentation that was given to me when I was in high school thinking about going into PT. A little personal story, when I was in high school, I volunteered at a local hospital, and they had us part of our school program where they would have us volunteer in different areas of the hospital, pharmacy, up on the nursing floor. We would do patient transport, and we did the therapy gym. And, having no information, I thought, hey, the PT gym is the place where all the people are laughing and having fun and having a good time. That seems like a good career to get into. But I had no idea about anything related to the career. Just knew that it was a fun place. Patients seemed to enjoy it. You got to establish really good, long-lasting relationships with patients, and you got to spend time with your patients and really see them over a long period of time. Rehab and get to a place where they hopefully return to the things that they love doing. So, with that little intro, I'm going to kick it off. So, the physical therapy profession. Um, so, so physical therapy. What is physical therapy? Well, here's a formal definition, but in short, PT helps people move better, helps improve movement and physical function to prevent and/or treat injury and chronic disease. In the big picture, physical therapy is vital to keep people moving. Movement's one of the keys of life. Think about how your life would change if you couldn't move or your mobility was limited in a way that you're not used to. Movement doesn't just refer to running and dancing or sports activities. We're also talking about just basic, what we call activities of daily living. So sitting, standing, walking, playing, both children and adults, bathing, breathing, and even doing some specialty things like lymphedema therapy, keeping lymph moving through the body, is another thing that we can do in physical therapy. Physical therapists help people moving so they can live life to the fullest and have the highest quality of life. Physical therapists are movement experts. They are currently, most schools offer a doctoral degree. So they're licensed doctors who examine, diagnose, and treat movement dysfunction. Um, they help people impacted by disease, injury, and disability. And they're anatomy and physiology experts. Physical therapists have an in-depth knowledge of the body's muscles, bones, nerves, ligaments, tendons, blood vessels, etc., and how they all work together to keep people moving. We prevent movement loss and promote wellness, and we use a variety of therapeutic exercise, different modalities, different treatment interventions. We work with patients with assistive devices like walkers and wheelchairs and canes. We do a lot of patient education, whether that be on body mechanics, posture, their gait, and with athletes, their movement patterns and their different sport-specific movements. And we try to incorporate evidence-based research in all of our treatment protocols in order to treat patients optimally. So, along with physical therapists, there is another profession known as a physical therapy assistant, and they help to collaborate with PTs. They're licensed or certified clinicians that provide physical therapist services under the direction and supervision of a licensed physical therapist, kind of like a physician's assistant to a physician. Physical therapist assistants are not trained to examine and diagnose as physical therapists are, but they're trained to assist with the implementation of a plan of care and treatment. So in a physical therapy clinic, you'll have physical therapists that will perform the initial evaluation and establish that plan of care for the patient. And then oftentimes the physical therapist assistant will work in conjunction with that therapist to carry out that plan of care. They are the eyes and ears for the therapist when they're treating the patient. The PT PTA bonds are usually really strong. There's a lot of communication going back and forth to make sure that the plan is being carried out appropriately and that patients are rehabbing on an appropriate timeline. There is a difference between physical therapist assistants and aides. PTAs are licensed and trained to provide healthcare services, while PTAs, which you might hear about, perform non-medical tasks and assist with clinic duties, and they work under the supervision of PTs and PTAs. And again, rehab aides, you'll hear them sometimes called rehab techs. They often are used in clinical care models to help, with different activities, treatments in the clinic, but they're unlicensed. They're definitely trained on the job to help out with a variety of activities, setting patients up on equipment, maybe taking patients off of modalities like hot packs and cold packs, that kind of thing. So those are the kind of the three levels of providers you would typically see in a physical therapy clinic. So one of the many patient populations that PTs and PTAs treat are those living with a disability. In the U.S., and this is a source in 2014, the United States had 21 million adults with some sort of disability, including the loss of mobility. Physical therapists work with these patients to examine them, develop a treatment plan, and work with patients to help regain, maintain, prevent, or slow the loss of movement. So next section is pretty cool section, one that I like. It's called 8 Things That You Didn't Know About Physical Therapy. There's a lot of misconceptions about what physical therapy is. The next few slides, I think, will give you a better understanding what PT is, what PTs and PTAs do, and what you can do as a physical therapist. So one of the misconceptions is that only licensed therapists and PTAs can provide PT services. PTs are not personal trainers. They're not massage therapists, not athletic trainers or chiropractors. Physical therapists are movement and body mechanics experts. They're licensed clinical doctors. Like I alluded to before, we're evidence-based practitioners. So we go off of a variety of different evidence-based protocols, whether those be from literature, from some of the research institutions that help devise these protocols, and sometimes local surgeons or doctors that we work with will have their own protocols that they maybe bring from a different institution that we will help carry out under their supervision. And we're really trained to diagnose, examine, and treat all populations. We treat basically from birth till death. We treat pediatrics, adolescents, adults, geriatric patients. So there's a lot of different areas that you could get into that might interest you depending upon the age group. And really, the overall goal is to increase movement ability and help the body heal the body using that movement. So, like I said, PTs and PTAs care for people of all ages. We treat patients across the entire lifespan from infancy to end of life. As a PT, you can work with pediatric through geriatric patient populations and all in between. If you end up in a, I would say general outpatient clinic, you'll see little children, toddlers, all the way up through geriatric patients. So it's a pretty cool setting to work in because there's a lot of variety, and you get to learn about growth and development across the lifespan, as well as how to adjust your communication and your instruction style to the patient that you're treating. PTs and PTAs, we work throughout the healthcare system. So obviously, in my case, we work in the hospital and acute care facility. Some therapists practice in private practice. You see these clinics all over the state, ATI Physical Therapy and Pivot Physical Therapy. Those are all kind of private practice clinics. Outpatient clinics, kind of a similar, category, but, maybe not a private practice, but an outpatient clinic associated with a hospital such as ours. Nursing homes, assisted living facilities, therapists work in home health, which is a very interesting area to get into. So they'll drive around the county throughout the day and treat patients directly in their home. Patients have to be deemed homebound by their physician in order to qualify for those services. My wife was a home care therapist for a long time. She thoroughly enjoyed it. We work in the school system, helping the students with a variety of maybe movement disorders or speech language. Pathologists will work with them on communication, language disorders, sometimes some swallowing issues, feeding issues. Sometimes they'll work in sports and fitness facilities, may have a clinic in there that's a therapy clinic, but they'll also have like a wellness or a sports performance component to it, where once their formal therapy is done and they maybe want to get to that last 5 or 10% to return to sport, they'll work with the athletes on sports performance drills, speed, agility, strengthening, those kinds of things. Corporate offices, so some of the larger corporations in America have partnered with PTs to come in and do body mechanics assessments on their employees, to conduct strength and training classes, exercise classes for their staff, educate them on proper posture. A lot of folks have to sit at a desk nowadays, and you wouldn't believe it, but most of our neck and back patients come to us because of sitting all day. It's not always just lifting something heavy or, playing a sport or something where you hurt your neck or back. PTs and PTAs work in the military systems, in public health, and many more. PTs and PTAs can focus on specific areas of care. We're trained to treat all patient populations. The schooling that you go through helps to prepare you for a variety of these special patient populations, and to be able to work in multiple environments and specialties. Many people are not aware that there are also special areas within the profession of physical therapy. You can choose to be a generalist, or you can focus on a specific area. And these are kind of some of those areas that you'll see. Us in. We'll treat cardiovascular, pulmonary, clinical electrophysiology. Some physical therapists do what are called EEG tests, which are tests to determine nerve function after injuries, treating geriatrics, neurology, oncology, orthopedics, pediatrics, sports, women's health, and wound management. And wound management is an interesting field. This has kind of been split up over the years. A lot of nurses will do wound management, and in some other locations and towns and areas, the therapist will actually do the wound management. So just kind of depends on the local area, what kind of provider would provide wound care for a patient. PTs and PTAs treat multiple body systems. So when we go to PT school, like I said, there's a very heavy focus on anatomy and physiology. That's the first course you take, and we get into all these systems. Now, we typically are treating the musculoskeletal system, but we have to understand all these other systems and how they interplay with the musculoskeletal system and overall health in order to treat the patient from a holistic manner. So, we learn a lot about the cardiovascular system, respiratory system, the integumentary system, definitely with wound care. Musculoskeletal, obviously, the nervous system for our stroke or neurology patients, urinary renal. So incontinence, urinary renal, reproductive, the pelvic pain and incontinence, there are physical therapists that provide pelvic floor therapy for a variety of cases, sometimes women after surgery, those with generalized incontinence, or other sort of women's health issues that they can help them with. And then there's another specialty subset, the immune system and lymphatic. You'll see therapists that are trained in lymphedema. Lymphedema is kind of a system of kind of filtering fluid through the body to be processed and excreted. But with certain conditions, that edema can build up, and those therapists can help with specialized garments and exercises and stretches to help clear, whether it be an upper extremity or lower extremity, depending upon the injury, clear that limb of that excessive swelling, which affects sensation, movement, and strength. And then lastly, the digestive system. So kind of interesting, you do not have to be a science major to pursue a career in physical therapy. Some of the popular majors of PT school applicants is exercise health science, Spanish, business administration, psychology, and liberal arts. With that being said, though, you will have to take science courses, but you do not have to be a science major. So it's very important, if you're interested in going to PT school, to look at what the requirements are. And if you're interested in one of those majors above that maybe isn't science heavy, to talk with the counselor or the admissions expert there to determine if you could pursue that major, and at the same time, fill in your science requirements so that when it does come time to apply to PT school, you have the necessary credits for that. Interestingly enough, in my physical therapy class, we had 2 creative writing majors that went to PT school. So we always used to joke around to ask them to write us a poem or a story during class as a joke, but they were great physical therapists nonetheless. So there are 2 physical therapy career pathways. The first is the pathway to a DPT. So this typical pathway is linear, getting your high school diploma or GED. going on to apply to a bachelor's degree program, completing it, and then going to a 3-year DPT program. And then some of those DPT programs are not just your 4-year bachelor's degree followed by your 3-year degree. Some DPT programs offer freshman entry, and they often will condense that DPT program from a total of 7 years to a 6-year. I went to a 4 and 3. My wife went to a freshman entry program where she completed her degree in 6 years. So it just depends on what school you'd like to go to, and then what your thoughts are on timing as far as graduation. And then once you graduate from your DPT degree program, then you can register and sit for the DPT licensure exam to obtain your license. PTA is a little bit of a shorter path, so they'll get their high school diploma or GED, go to a 2-year associate's degree, and then they can then sit for their PTA licensure exam. So much more of a condensed education timeline. And as a physical therapist, obviously you will be a trained clinician. However, there are multiple pathways you can choose within the profession. There's a variety of jobs you can do. You can be a clinical practitioner. You can be a board certified specialist, which is you can find an area that you're interested to. There's a few areas of specialty: orthopedics, sports, geriatrics, that you can obtain through the American Physical Therapy Association. You could be a PT resident or a PT fellow at a university, which is kind of a little more intensive training, postgraduate training. You could be a professor or program director at a university. You could do research. A lot of my classmates ended up going into research after graduating, went on to get their PhDs in a variety of areas. You could be a professional advocate. You could go on to work for the APTA, being a staff member, a CEO, board member, and even going to Washington to lobby for various issues that are important to the physical therapy profession. A travel PT. We actually somewhat frequently hire traveler PTs when we can't fill a position. And so these PTs, they'll typically go on 12 or even sometimes 16-week contracts where they sign on with an agency. That agency helps to place them somewhere. And you'll see this, a lot of new grads will do this for a few years because they want to travel and see America, see different areas of America and how they treat, and ultimately use those few years to help not only make a little bit more money than if you were just working at a regular clinic, so that helps with student debt, but also to maybe find a place that they may want to settle down and maybe eventually start their career and a family or whatever. You could be an entrepreneur. There's a bunch of physical therapists that have created a variety of continuing education programs that you can obtain specialty certificates through, and also PTs that have developed various patented products that we use in the clinic on a regular basis. And then, I'm a little old for this, but an influencer. My Instagram feed is filled with some of these PT influencers. That's certainly a direction you could go, and I'm sure there's much more opportunities as well. All right, so let's talk about the education. So to be a PT, you must complete your professional doctor of PT degree from a CAPTA, that's CAPTE, accredited physical therapist program. So CAPTA helps to go around and survey the various university programs, make sure that they meet certain requirements, and then once they meet their accreditation, that is a school you could go to in order to get your degree. Upon completion of that program, then you can sit for your National Physical Therapy examination. They call it the NPTE. And once you pass that exam, then you are eligible to apply for your licensure in whatever state that you practice. And some states have a licensure compact. So if you apply in one state, you get a license. Your license is reciprocally recognized by several other states. And there's a bunch of different compacts. I don't know all the specifics, but if you'd like to, you could look up license reciprocity for physical therapists, and you can see the various states that have kind of bundled together. So in order to enter a DPT program, I know we talked about it, but you must obtain a bachelor's degree. Then most DPT programs take about 3 years to complete. However, like I said, there are some freshman entry, which will usually condense the program down to 6 years. Um, for preparation, the DPT program curriculum is heavy on basic science, so having a strong science foundation is helpful. Biology, chemistry, physics, anatomy, physiology, biomechanics, mixture of those. But you also want to make sure you have a good understanding of the profession, what PTs do. You can do this by shadowing a PT, volunteering, finding a PT or a PT student mentor, and looking at the APTA website for further information. Pretty much any clinic down here in Sussex County, if you reach out to us or to any of the other clinics in the area, they're always happy to have students come in. I can at least speak for us personally. We're always happy to have students come in to shadow, to obtain volunteer hours, because those are very important to have on your resume when you're applying to PT school. In fact, most of the PT schools have hour requirements to be considered for application. So that's something, if you're interested, you do want to check with the school that you're interested in to see what the volunteer or shadowing requirements are. And most DPT schools require prereq courses, a PT observation hours, like I said, and some letters of recommendation. And so those letters of recommendation are very important. And really, the best way to get those letters of recommendation is to shadow and work in a clinic and be a part of that team for several months or a year or more, and then establish some strong bonds with the clinicians, so that when it comes time to asking them for a letter of recommendation, they would be more than happy to help you with that. And then about 95% of the DPT programs require applicants to apply via the PT CAS. It's kind of a new system. It wasn't around when I was going to PT school. It's just a centralized application service. It's made things a lot easier. You can go on there and you can apply through PT CAS. It opens in July. And when you put your application in, you can then select multiple schools that you wish to apply to at one time. Whereas back when I applied, it was kind of, you had to apply to each individual school. This has made it easier for multiple schools to look at candidates, and then candidates to also select multiple schools that they're interested in. The curriculums at the schools are usually a mixture of a didactic lab, so hands-on in classroom learning, and then clinicals. Throughout your time in PT school, you'll typically do multiple clinicals. So you'll have a clinical in a hospital setting, a clinical in a outpatient setting, a clinical in a specialty clinic, such as like a spinal cord injury, rehab facility. You may go to a skilled nursing facility. And then there's typically elective ones where you can, towards the end, where you say, hey, I'm really interested in doing orthopedics. I want to do 2 more in an outpatient clinic where they see athletes or, joint replacements, knee replacements, whatever you might be interested in. And then kind of and now this is, even since this presentation was created, curriculums have changed. There is a lot more remote learning happening. Some schools, there's a school in the South, I believe it's called the University of the South, where students are trained remotely for 3 weeks, and then they travel to the actual school, which is, I believe, in Atlanta, Georgia, and they spend a week just doing labs all week, doing hands-on labs and tests, and then back to a 3 week of remote. So I think this is something that's kind of come out of COVID, and also people's preferences about time commitments in their life. So if this is something that interests you, you may want to look into schools that offer that as an option as well. And then when you graduate as a doctor of physical therapy degree. And again, not to belabor the point, but you then sit for your licensure exam, which would allow you to practice in whichever state you wish to choose. The PTA, it's kind of redundant, but PTA is shorter path, but you must complete a associate's degree from a CAPTA accredited PTA program, and then upon completion of that, you can then sit for your PTA licensure exam, just similar to PTs, and then pass that, you'll be able to practice in your state. So, time commitment. So to enter a PTA program, you must obtain your high school diploma. Most PTA programs after that are 2 years. However, some programs will accept transfer credits, so it could take less than 2 years. To prepare for the PTA program, you want to have a good understanding of, obviously, just a general science background. but understanding some parts of the profession, mainly anatomy and physiology. And you can gain more of this knowledge, like I alluded to before, by shadowing a PT or a PTA and volunteering or finding a PT or PTA student as a mentor. Um, so some PTA programs require the prereqs, observation hours, and letters of recommendation, as I alluded to. You can research the programs through CAPTA, which is that central database, and you can also do individual program applications if you wish. And just like PT school, they are often broken up into didactic lab coursework as well as clinical affiliations where you spend anywhere from 6 to 12 weeks at a facility type hospital or clinic, outpatient clinic, and you treat patients under the supervision of a clinical supervisor. And when you graduate, you get your associate's degree and can then sit for your licensure exam and certification. So why choose physical therapy? There are multiple career options even in healthcare, but why should you choose it? Well, movement is essential to life. If you love anatomy, physiology, muscle movement, exercise, and you're curious about human body movement in general, then physical therapy is a great career option. PTs and PTAs do more than help people moving. In some instances, they help regain their life, regain their quality of life. I was drawn to the profession, not just because the gym seemed like it was fun and everybody laughed and had a good time, but I was an athlete as I grew up, and I really, really wanted to work with athletes to help them move optimally and get them back to return to sport after, sometimes devastating injuries that really, really affect them mentally and physically. That was my passion, was to work with sports medicine patients. I'm hoping this video will play, Tim, but we're going to try it out. And if not, I can maybe send the link out at a later time, but let's cross our fingers.
When the explosions happened and my leg was gone,
Can you hear it?
my biggest thing was, number
You're
one,
good.
staying alive. I mean, I really did think that was it for me. I thought that my quality of life would be a zero. Mustering up the gut to be able to actually do it and feel my limitations was so tough. It was more mental than physical. My physical therapist completely understood that and knew that I needed the mental capacity to be able to do it. And she just kept my eye on the prize. Physical therapy means everything to me. My physical therapist taught me how to walk again, and that taught my family and people around me that I was physically able to do anything that I put my mind to.
I always liked that video. I think she said something there about making me believe or helping me to believe or something like that. A lot of what we do is definitely scientifically based. It's from the treatment interventions, it's evidence-based practice, but oftentimes the biggest impact that we have on our patients is our ability to establish a strong bond, a professional bond with them, to motivate them and to, I don't want to say from a true perspective, be like their psychiatrist or psychologist or counselor, but your patients are going to come in, and some days are better than others, just like all of our days are. And it's our job that day, even when they're having a bad day, to try to reframe their mind to a positive mindset and focus on the goals. And for an ankle sprain, that might be pretty easy. It's a small injury. Rehab's fairly short. But for somebody who's lost a limb, who's had a stroke, who's had a serious knee injury in, say, a football game, they're thinking they may never play football again. Those are the patients that we really try to establish deep bonds with to motivate them and to keep them connected to their purpose and to the long-term goals. And that's one of the most rewarding things in the profession. Certainly, there's some scientific research about how to best communicate and how to what methods of communication and types of communication to accomplish that. But there's also an art to it. And so, if you've ever been to a PT clinic or would like to come to a PT clinic to observe, you'll see a bunch of professionals that over time they kind of hone their skills, their people skills, about how to read people's body language, about how to listen, about how to provide feedback that is positive oriented. And so that's an art. There used to be a quote the APT used to say was PT was the science of healing and the art of caring. And that can't be more true. There's also been some interesting studies that show the number one predictor of patient success in physical therapy isn't the intervention always that you do. It's the relationship, the strength of the relationship between the therapist and their patient. So if there's one thing I can't underscore enough is that it's not just the science, not just the knowledge, not just telling people how to do things better. It's bonding with them, creating that bond that they trust you and that you're going to get them on the right path. And it kind of goes that old saying, it's people don't care how much you know until they know how much you care. So a lot of PTs are very empathetic.
When the explosions.
All right. So physical therapy is a personally, professionally, and financially rewarding career. It's consistently ranked as one of the top health professions. US News did a ranking a few years ago where it was ranked number 10 best healthcare job and number 15 in the 100 best jobs in the United States. It's a profession that's predicted to continue to grow. People are living longer. The baby boomer generation just each year is more and more, as they age, more and more patients in that demographic. And physical therapists are going to be needed for the foreseeable future. Definitely for the next 20 years, we foresee continued growth. Salary levels are strong. The 2023 median salary for a PT was $99,710, and for a PTA was $58,740. And like I talked to before, physical therapists, we foster relationships with our patients. On average, we spend more time with our patients than any other health professional does. We have typically 30 to 60-minute appointments and potential multiple visits that continue for weeks. So when you add that up, if you're seeing somebody an hour 3 times a week for 12 weeks, you're going to see them for 36 hours. It really gives you an opportunity to develop a unique bond with that patient. And what I've always loved is the patients that become our patients for life, just like a patient becomes a patient for life with their primary care. When I had my last outpatient clinic, I would treat a child when they were maybe 10 that had an ankle sprain, and then watch them over 10 years go on to high school and college, and then eventually into professional careers. And that was always very rewarding to see. And then, that relationship allows you to see the direct impact and benefit of your work and their overall progress over time. So it can be very rewarding. So how to prepare? What can you do now to start preparing for a future in PT? Number one, do your research. There's a great website, just apta.org, the ptcast.org website, which is the how to apply to PT school, and just looking at individual programs that might interest you. You could shadow or observe a PT or PTA to see what it's like up close, and try to diversify your experience. If possible, observe more than 1 or 2 days in a variety of settings and with a variety of patient populations. Maybe pick 2 or 3 populations that you want to see or settings, and shadow in those areas, and maybe try to hone in what you're most interested in. Find a mentor. Around here, there's a load, at least in Sussex County, there's a load of physical therapists and PTAs, and especially ones that are always willing to have a student follow them and help mentor them through their path. You can prepare by reviewing anatomy and physiology, depending upon what your middle school or high school offers. You can get into that, or there's obviously also private courses you can take, different apps you can learn those things through. And then, really the main thing is to try to build a strong science foundation. So science courses such as biology, chemistry, and physics are required to enter PT school. So anything you can do to ensure a solid foundation in these courses will be helpful. So some additional resources, these are the things that I had just mentioned before, but the APTA, which is the American Physical Therapy Association, is a great website. It's got a ton of resources, a lot of free content that you don't need to be behind a paywall for. PTCast, which is the centralized application service. It's definitely kind of a very vanilla and boring site, but it goes through like how to apply, when do you apply, goes and answers a bunch of questions on their FAQ page. The Commission on Accreditation, this just kind of goes into how different schools are accredited, and I believe there's a list on their website that will show which programs are accredited, but the easiest way typically is just to go to that specific program, say University of Delaware, and they'll have on their website that they're CAPT accredited, because it's the standard needed to be accredited to train students to sit for the licensure exam. The APTA has a free financial literacy resource, helps kind of like map out, school expenses versus like salaries and maybe what's the best path for you. And then if there's any questions about PT careers or pathways to PT or PTA, there is a student recruitment website that you can reach out to. And then, as always, social media. APTA has a Instagram. APTA has a tweets or X profile. YouTube has some Choose PT videos, which are good resources, and the American Physical Therapy Association has a Facebook page. And that is a wrap. So I'm going to open it up now to questions and answers. And here's one more slide. It just has the financial resources. On there are some free sort of financial skills advice, and then also a national scholarship portal where you can look in there to see what scholarships are available and to maybe apply for those to help reduce the cost of your schooling.
All righty, very good. Well, we've got some questions queued up if you want to stop sharing so that you're bigger on the screen. And there you go. All righty. Let me get to well, let's go with an interesting one first. Do you work with celebrities?
Without divulging certain names, yes, at times I have worked with, due to HIPAA privacy laws, I've worked with celebrities and professional athletes.
All right. How about any national politicians? I'm joking. Anyway.
I will just say, due to our proximity to the beach, anytime that President Biden, when he was in office, the Secret Service comes to the hospital to just do a sweep of the hospital just in case President Biden would have needed services. So I have not worked with any politicians, but if President Biden had ever needed care, he would have came to our hospital.
All righty, very good. So a question not about PT, but a more general question. What are pathologists?
So I'm not sure I'm the best to handle this, but a pathologist, I believe, is somebody that's going to, are we talking about like a lab pathologist?
Well, yeah, there are a lot of different types of pathologists.
Yeah. So I would say a general pathologist is just trying to investigate, what is the underlying pathology that's causing whatever symptoms or disease processes. And my more interaction is with lab pathologists. So they're down in our lab, our clinical lab at the hospital, and they help interpret the tests, the various I would call cultures and samples taken from patients to help diagnose, what condition they may have. So they may do a biopsy from some tissue in the body and then help to identify is this cancerous or non-cancerous. So.
All righty. And for everybody, I just dropped into the chat sort of the different domains or realms of pathology, diagnosis, and molecular analysis. And autopsies and whatnot. So you can read that there. So you work at BB. Do you work with other physicians, for instance, in patient post-op?
All the time, all the time. Yeah. So in the inpatient, um, well, I'll say me personally, as the director, I do not treat patients. So I'll disclose, I'll put that disclaimer out there. However, our clinical staff that I help oversee, yes. So the patients in the hospital, there will typically be a hospitalist, an internal medicine doctor that follows that patient while they're there. Our staff work closely with them. And then oftentimes there's consulting doctors that come in. There's a GI doctor or a vascular doctor or cardiologist. And so they work with them on a multidisciplinary care team to help treat whatever pathology the patient's dealing with, and then also our team helps supplement that by ensuring we can get them to be the most mobile. And what we help mostly with on the inpatient side is to help the doctors decide, okay, once Miss Smith, for example, is going to be discharged from the hospital, what's the safest place for her to go? Should she go home by her, independently with maybe some equipment? Should she go home with some home health? Should she go to a skilled nursing facility? Should she go to an acute rehab? Or should she go right to an outpatient clinic? So yes, we work with them pretty closely on the inpatient side. On the outpatient side, the physicians refer to us, and then we treat their patients under our plan of care, and we're in pretty constant contact with them. We send them notes regarding their care, the plan of care for that patient, and then anytime they have any clinical changes, we pick up the phone and we'll leave a message or hopefully get on the phone with them and say, hey, we saw this patient, we're noticing something else, might be something that you want to have her back in the office for. So we have very good collaboration down here. Sussex County is like a small town, so everybody knows everybody and everybody's very polite and willing to pick up the phone to do what's right for the patient. So we
All
do
right.
work with physicians frequently.
Okay, so Manifa and I both have the same question, which is you mentioned something that I'm surprised I've never heard of before, but it was an advocate physical therapist. Can you
Yeah.
tell us a little bit more about that? And is that career path different from the one that you took, or is it just where you focus your energies?
It's just where you focus your energies when you're done. So, it's sort of in that box between being an influencer per se and being involved in perhaps a lobbying group or the APTA um, to advocate for the profession. And so, professional advocate is somebody that advocates to the public, hey, this is what physical therapists can do. Or it may be more than that, advocating to different governmental bodies as to, why certain regulations might need to be, changed or amended or improvements to the healthcare system of that state or that local area. So you would go through the same career process. It would just be something that you would likely pursue after you graduate. Currently, when you're in school, you don't get placed in like a lobbying group or working for the APTA. They have you focus on clinical stuff first. So a lot of the APTA advocates and folks that work for other lobbying groups, they typically get into that after a several year period of treating clinically, and then they want maybe a new challenge, or over the years they've seen some of the challenges that the profession faces, and they feel like their experience and knowledge can help solve those problems.
Okay, this is sort of an age threshold for volunteering question and shadowing, I think, but what's the minimum age before somebody can actually shadow and volunteer at BB?
I will have to get you the answer on that. I think 14 is okay. I think if I'm looking at the right question.
Yeah.
I think 14 is okay. But I can check with we have a student liaison that helps set up the shadowing for the organization. I could check on that and get back to that individual if they want to.
All righty. I'm going to take Ashley's question since you're a physical therapist. Um, Radiology is a great career. All of these are great careers. I think the differentiation between radiology and a lot of other careers is that you're going to have a longer educational takeoff that's going to include medical school and then doing your residency and then doing a fellowship. So it's gonna take longer before you're actually practicing your craft on the floor. That said, there are also radiology technicians that do very important work, and I guess that's outside of your SLP PT scope there, but I'm sure that BB has RTs as well.
Yeah.
But becoming a radiologist or even more an interventional radiologist, that is a significant educational mountain to climb, but very rewarding from what I've been told from my colleagues. Okay, what do you recommend? Recommend physical therapy is better, PTA or DPT? Oh, all right. So doctor physical therapy. All right, go. Oh, you
Yeah.
two.
So this is definitely an individual preference in my mind. Um, First thing you have to ask yourself is, do I want to go to school for 4 years or do I want to go to school for 7 years? I think that's a very basic, fundamental question that you should ask yourself. And then the second question would be, do I want to be the person that evaluates the patient and helps to establish the plan of care? Or do I want to be the assistant to sort of help that therapist that's established that plan of care? They're both very rewarding careers, but me personally, I've always watched a lot of those like detective shows, crime shows, 60 Minutes and Dayline and all that. And I have a very detective mind. I want to know what's going on, gather evidence, figure out what's going on. And so that's what really drew me to being a physical therapist is you get a patient, they sit down in front of you, they tell you your story, and then you become the detective. Okay, let's figure out what's going on. And one of the best things about it is we get a patient that comes from a doctor that gets several minutes to see them, and that's just kind of the model of their care. We get like an hour to see them. So we really get to dive in deep, ask very in-depth questions, very specific questions, review their histories, and to really dial in on what's likely causing their issues. And so for me, if you're like me and you want to really help evaluate and diagnose patients, I think PT is better. But if you're like, and I don't know if I want to go to school for 7 years, but I really like to help people out and treat them, then PTA is also a great career. Um, so
All
I
righty.
don't know if I answered that well enough, but
So I'm sort of circling back. Do you work with physicians specifically? Do you work with neurosurgeons?
yes, we do have a neurosurgeon on staff at our hospital, and we work with them.
All righty. So how do you approach patient evaluation and treatment planning?
Yeah, that's a good question. So when we get a new patient, we bring them back. We go into a private room, and we've already had them kind of fill out some paperwork, like their past medical history, medications, family history. Sometimes we give them these outcome questionnaires. Like if it's their shoulder, we give them this questionnaire called the DASH, and they fill out how their shoulder is feeling with different movements. That gives us a score, and that kind of helps give us a baseline of what do they think their shoulder is like, not only from a pain level, but how well it's functioning. And so we take all those sort of history things and we start to formulate, a baseline of where we think they are, and also a very loose prognosis of where we think they can be. We then dive into objective assessments. So if it's a knee, per se, I'm going to look at knee range of motion. I'm going to look at strength. I'm going to look at balance, coordination, and I'm going to look at movement patterns. And then lastly, I'm going to have them walk because I want to see how they walk. And then we kind of take all those clinical pieces and we synthesize them into a treatment diagnosis. So an important delineation to make, when they come to us, they'll come to us with a medical diagnosis. So you'll get a patient that has a prescription that says knee pain. It'll have a code 719.46, knee pain. We, as a therapist, when we diagnose the patient, we actually attach what is called a treatment diagnosis to them, a reason that we're seeing them. So we may have a patient that comes in with knee pain, generic knee pain. We evaluate them, we look at them, we do different special tests to check the ligaments, check the meniscus, to check the joint, and then we establish a treatment diagnosis, which could be an ACL sprain, could be an ankle sprain. And then we also put in other diagnoses like difficulty walking, abnormal gait, based on the other things that we see. And so those are the things that we're trying to treat. We're diagnosing movement problems, not necessarily the specific tissue that was injured. We will put the specific tissue injured um, based on the clinical tests that we do, but the treatment diagnosis is the key. And so once we have their history, we've done the objective tests, we sit down, we discuss with the patient what we think is going on, and then we lay out the plan of care for that patient, and we try to discuss that at the initial evaluation. And our patients always leave with a home exercise program after the first visit. That home exercise program could be very in-depth. It could be 4, 5, 6 exercises, or it could be for a knee. For a back patient, it could be you slouch like this, like you're watching your phone for 5 hours. We need to get you to sit up nice and tall, get your shoulders back. Let's talk about a cushion on your chair. If you're sitting for 7, 8 hours a day, let's talk about maybe interrupting those long periods of sitting with walking around. And so it could be a variety of things. So we talked about the treatment course. They get a home exercise program. And then when that patient leaves the clinic, we set up that plan, certainly for the first week or two, but we usually have a protocol that we're going off of, those evidence-based protocols, which is sort of a cookbook. It's saying, here, these are the things that have worked off of research, and you follow that, but you individualize it to the patient. Not every patient's going to respond the same to whatever you're doing, and you're going to have to modify certain exercises based on people's ability to perform them or not. So that's how we evaluate and treat.
All righty. Hold on for a second. I'm typing an answer to somebody. Okay. All righty. All right. So how soon can you tell if a specific PT plan is working or not?
Yeah, I mean, it's a very good question. The answer is very nuanced. So if we have a neck or back patient, we typically are trying to do various manual techniques in conjunction with exercise and some posture things. And I like to see improvement in the first 3 sessions. It's not a hard and fast rule, but if you've come in with neck or back pain, and in the first 3 sessions, we haven't improved your pain, we haven't improved your movement, your degree of movement, or we haven't improved your mechanics, then we need to sit down and talk through it. And there's a variety of reasons why it could be. Maybe I misdiagnosed the movement dysfunction, and I need to go back and reevaluate how your neck moves. And I need to go in there and put my hands on your neck and see how the vertebrae are moving and your joints are moving. That could be it. The patient could be non-compliant with their exercises or their desk setup or their sitting mechanics and lifting mechanics. So we'll go over that again. How are you lifting off the floor? How are you sitting? Show me your sitting posture. Did you do your home exercise programs? Luckily, our new electronic medical record allows us to track whether patients are doing their home exercise programs at home. So that is a new tool that we really haven't had previously. So that's essentially how we are determining things. If you're not feeling better in any way, it's not always pain, because depending upon how acute they come in, so say you fell and you hit your SI joint on the ground, slipping on the ice in the next few weeks, that inflammation, that joint's going to be there for 2 weeks, maybe 3 weeks. And until that inflammation kind of calms down, you may not see significant improvement in pain. Now, the physician is typically prescribed a medication to help with that inflammation, and we do things to get that inflammation down. But sometimes it's just a time thing, and we're very upfront about that. Hey, this is very acute. We're going to try some gentle movements to see if we can get what we call directional preference, a direction that's going to help reduce whatever spine issue you're having. And then we kind of go from there. We also do this intervention called dry needling, which I'm not sure if anyone's familiar with, but we basically take acupuncture needles and we place them into muscle tissue to help with knots. It's been shown to be more effective than like cranking on someone's knot with your thumb or with a tool. And with dry needling, if we don't see a improvement in 3 sessions, then we typically say maybe this intervention isn't going to work. That one's a little more research based, like cut and dry.
All right. Well, and what a perfect segue into the question that I think you can
Yep.
read on your screen. I'll let you dissect that and address it.
Yeah. So in general, our muscles have an ideal length tension relationship, meaning when our muscles are sitting in a correct length, they're able to generate optimal tension based on that length. So if somebody comes in with a quote unquote knot, what we call a trigger point, that trigger point is a shortened band of muscle. And that muscle is not, because of it being shorter, it doesn't have as much tension in it, and thus it will not allow you to produce the same amount of strength or force. And so, yes, we will see folks who have, quote unquote knots or trigger points. It reduces their ability to lift or to have strength. Number one, typically because they have pain. Pain inhibits your muscle's ability to fire appropriately. So it doesn't get the signal out as fast. It doesn't get as much of the signal out to the muscle. And it kind of acts as a gatekeeper. So we really want to treat that knot first to get that pain level down, and then also to lengthen the tissue to a more ideal length. Because once we get that rubber band, as we call it, to a longer, more optimal length, it'll generate more force.
All righty. And then the other part of that question was, are there jobs for anyone who hasn't graduated high school yet?
Sure. So on one of my first slides, there was a job called a rehab aide or rehab tech. And so they are typically high school and college age students that are interested in seeing what the field's like, and then maybe even perhaps going on to do that later as their education goes. They are vitally important in the clinic. They help us with bringing a patient back, checking a patient in up front, getting them set up on the table, and we always set, not always, but we set up people in some elaborate positions or pillow supports to take tension off certain areas. And then they help bring over the instruments that we need to treat them. They'll walk patients and get them set up on equipment. They'll help us clean equipment. They'll help bring out some of the needles if we need to do dry needling. So they're similar to like an MA would be in a physician's office. So yeah, we do have high school students that work as rehab aides in the profession.
Cool. So I'm gonna hit on 2 things that seem to be sort of a little bit less age specific and somewhat either computer related or sports related. First is plantar fasciitis, and the second one is carpal tunnel. So if you could tell us what those are, and then the role of PT in treating those 2.
Yes. So plantar fasciitis is a typically classic symptom is sharp heel pain. And so your plantar fascia is a covering around muscles. It is a sort of like a saran wrap coating around muscles that helps to support them and keep them in form. It is non-contractile in nature, so it's more of like almost a ligament consistency, thinner than a ligament, but it helps to provide support. Plantar fasciitis is when that either at the insertion of the plantar fascia on the heel, at the bottom of the heel, or into the arch of the foot becomes inflamed. Plantar fasciitis is very difficult to treat. It's one of those conditions where you kind of do the spaghetti and throw it at the wall approach. We work with patients to maybe we look at their gait, first of all. Do they have any crazy gait pattern that's causing them to maybe overpronate? Overpronation is when your foot kind of rolls inward excessively when you walk. Those patients will recommend getting into like a motion control shoe to help with that. Maybe some arch supports if they have flat feet and to control that pronation. And then we focus heavily on stretching the gastrocnemius and the soleus, which are the two calf muscles, as well as doing toe stretches, stretching the 5 toes into extension to help stretch the arch. And then we also try to do deep tissue massage to the arch of the heel, some cross friction massage at the heel spur where the fascia attaches to the heel spur at the calcaneus. And then we also do some dry needling in the feet, which some people love, some people don't want to be anywhere near it. And then there's some other modalities like electrical stimulation to help with pain and also ultrasound. Ultrasound doesn't have as high a degree of effectiveness, but sometimes when we have a very difficult case, we will try everything we can. And just a public service announcement, flip-flops and high heels are not good for plantar fasciitis. So I know they look cool, but they're no-nos. especially
Alrighty.
especially if you have them, if you have it. And then carpal tunnel is, something you'll typically see with somebody that does something repetitively or with like vibration. So somebody that operates like a jackhammer or a power instrument that's vibrating in their wrist, or typing for a long time because your wrists are flexed. And carpal tunnel is a inflammation or compression of the median nerve that's in your wrist. And so carpal tunnel, it's very classic. There's an easy test for it. It's typically just kind of bringing the two hands together like this, or even just holding this down. They'll start to get reproduction of some of the paresthesias and pain in their wrist. And what we do for those individuals is we try to get them into splints that actually cock their hand back a little bit. So we open up the space, we maximize the space. So while they're sleeping or while they're awake during the day, trying to wear that splint so that we can take pressure off that nerve. The longer the nerve has pressure on it, the more aggravated it's going to be. And then we do just kind of generalized stretching and soft tissue work. It's all about just getting that tunnel that the nerve runs through to be less compressed. And then the longer that the nerve has been compressed, we also want to focus on doing some strengthening activities because they often are weaker.
Alrighty. And so I'm answering a question from Jaden. Are there any hospitals in South Jersey area around Camden and Evesham for volunteer programs? And my answer to this is going to be that's probably a question for Google. We know a lot about Delaware, not that much about Southern New Jersey, but perhaps our speaker does. Do you have any idea, Joe?
I do not, but I like Tim said, I would reach out directly to that hospital if that's a setting you're interested into, or just calling some of the local outpatient clinics if that's something you're interested to. I think I can count on one hand. I've heard of people calling and asking to volunteer in shadow, and someone saying no. Therapists are typically always interested in having younger students because they like the energy, they like your positivity and your interest in the profession, and 99.9% of the time they want to help you out and tell you their life story and give you tips on how to, hopefully get into PT school. So.
Right, right. Well, and you just mentioned, I think, an important key, which is motivation. How do you help patients stay motivated during challenging rehab sessions or rehabilitation regimen, for that matter?
Yeah, so I like to have fun and I like to try to keep things light. That's the best way I can describe it, and positive, because it is a challenging time. And so I try to tailor my communication to be positive. And even in the midst of a very challenging time where maybe a lot of the metrics aren't moving very much, or the patient isn't seeing the progress because it's so small, is to celebrate the wins, whether they're small or whether they're large. I think that's very important to keep somebody focused on a trajectory, that the trajectory is not going to be linear always. It's going to be up and maybe down a little bit and up and down. But if we look at a graph, and we're able to do that in our electronic medical record, is to show, hey, they may come in one week and they're really stuck with their knee range of motion. but I can pull up a chart and say, hey, look, 2 weeks ago, you only had 90 degrees of knee motion and flexion range of motion. And today you're at 120. Yeah, but I've been at 120 for 3 days. Yeah, but you were at 90 3 weeks ago. And kind of reframing, look how far you've come. And then there's also some interesting pain science communication that I've taken some coursework on, which is really when patients perseverate or talk about pain a lot, it has actually been shown to be detrimental to their progression to focus on pain heavily. So what we try to do a lot with our spine patients, typically spine patients, is to focus on function and improvement over pain. Now, we don't ignore pain. If something hurts, we have to modify that and is increasing or it's going down into the leg. Those are things we do not want to continue to do. But if it's, hey, this hurts, say, okay, thank you for sharing that with us, but check out how much further you're squatting or check out how much further you're bending. And we really try to relate it back to function. And that level of communication on a psychological level has been shown to, over time, desensitize patients to pain and also to reduce the frequency that they focus and perseverate and communicate on pain. So
Right.
that's another way that I try to motivate individuals is through that kind of pain science communication.
And I've heard it said that pain is one of the few physiological symptoms that you can literally manifest for yourself.
Yep.
You can think yourself into to being in pain. I think the other thing that I found across my career is that people don't sometimes understand the vital role of pain in recovery. And you think about people with diabetic neuropathy where they don't have any sensation of feeling in their feet and they can walk across a blazing hot, sand and end up wondering how on earth they got these terrible burns on their feet. Well, because they didn't feel the pain while it was happening. So we do have an interesting relationship with the concept of pain and its importance. Let's see, back to so talk to us about PT and its role in lymphedema.
Lymphedema, yeah. So with lymphedema, it is a very specialized service. We actually used to have it for several years at BB, and our both of our very experienced clinicians retired, and COVID hit, and we really never really restarted it. But essentially, what they do is they get referrals for both upper extremity edema, typically from breast cancer procedures. To be honest, some head and neck cancers. And also they'll get lower extremity edema, which is typically from some kind of like venous insufficiency, venous disorder. And what they'll do is they'll work with the patient on getting them compression garments that are fit for them, that they wear during the day, that help to bring the fluid back up and then hopefully get filtered and by their kidneys and excreted through their urine. They do lymphatic drainage massage, which is kind of a manual technique of elevating the limb and then working on certain areas of the limb to help get that lymph back into the lymph system and then hopefully filtered and then into the kidneys and the urine or into the bladder. And then just general kind of range of motion and strengthening. Because if you can imagine, if you've had a very heavy leg for a long period of time or a heavy arm for a period of time, when you finally get that fluid down, it's really important to get your range of motion and strength back up because you probably haven't been using it for a while since it's been so cumbersome for you. So it's a combination of compression garments. They also get pumps for patients. So patients can get these pumps approved by their insurance that they take home and they can put their leg or their arm in there and it'll have a gradient pump, which will help pump some of that fluid out. And then also, working with the manual lymphatic drainage and doing some just general strengthening and range of motion and balance things. A lot of these folks have balance issues because of the size of the limb. It's an asymmetrical stance, and even if it's just an arm, their balance gets off because their arm swing kind of moves their trunk a different way. So we kind of look at everything, but the main goal is to try to get that lymphatic volume down.
Right. Okie doke. So there's a question in the chat, and I'm going to expand a little bit more. So first off, the relationship between, or the similarities and differences between PT and exercise physiologists and between PT and massage therapists. Go.
Yeah. So exercise physiologists, they typically, at least for our health system, they work primarily, they do a lot more with like cardiopulmonary rehabilitation. So at least in our system, we have exercise physiologists that carry out the cardiac rehab program. So somebody had a heart surgery or a heart procedure, they'll get referred for cardiac rehab, which is a supervised program to run them through a cardiopulmonary exercise routine over a period of 1 or 2 months. They'll also work with pulmonary patients in conjunction with respiratory therapists to devise the same thing, like a cardiopulmonary exercise routine to help those patients that have difficulty breathing maximize their cardiopulmonary function. So those are the two main areas that we see exercise physiologists in our system. But they'll also, exercise physiologists will work sometimes in cardiac testing. So they'll do like the treadmill stress tests with the EKGs. They're trained to kind of carry those out. An exercise physiologist is trained to implement these programs, but also trained to kind of design a program that would gather objective data to see on a scale best of where that patient's landing. So like a stress test, like how severely limited are you? So they work a little bit in diagnostic, but also in the rehabilitation areas, typically in cardiac rehab and pulmonary rehab.
Right, right. And massage therapists?
So massage therapists, they're licensed clinicians just like we are. They're not physical therapists. They do get some anatomy and physiology training. They can be very helpful to provide a much more like lengthy massage than you might get at a physical therapy session. So in a typical physical therapy session that might be 45 minutes to an hour, we're working on a variety of different things. So exercises, some cardiopulmonary exercise, some stretching, some joint moves where we're moving the joint, maybe balance activities and some other strengthening activities. So if there were some soft tissue massage that we want to do, we then are trying to prioritize, okay, do we do a soft tissue massage or should we try the dry needling? Because the dry needling can be more effective than the soft tissue to get out whatever tissue restriction that we're feeling. So we do massage, but we're not considered a massage therapist. And a massage therapist, obviously being licensed, you could go see them for like a longer period of time. So I have patients where, everybody loves the massage at therapy. They want that for the whole time. But it's a part of their overall plan of care, and we explain that to them. But if I really have a patient that thinks a lot of their restrictions are related to soft tissue, I will recommend them going to see a licensed massage therapist in conjunction with me. And then I'll ask them, with their permission, hey, have that massage therapist call me. And if they want, I'll kind of go through what I'm doing and the muscles that I'm working on. And we'll have a professional conversation of, hey, we're treating quadratus laborum or the psoas. Can you work on that? And then oftentimes they'll work on it and then call me back and say, hey, yeah, you were right, but I also found this. You might want to work on that in the next session. So we try to collaborate.
Right. Okay. I'm going to throw up a real quick poll for the people who are still on the call, just to see how people feel about PT after. I should have done this right when your presentation ended. It's always interesting to see what people get out of it, and it's nice here because we're seeing that, yeah, close to 10% of people say, yeah, PT sounds interesting. And one of the reasons that we do mini medical school is because we want to help individuals also eliminate what they do not want to do. That's an important component of this sort of exploratory educational experience. So it looks like overall either a yes or maybe I need to learn more. So yay for physical therapy. I'm going to go ahead and end the poll and share the results for you all, which I assume I can never see the results. Can you see the results?
Yeah,
Yeah. So
15% yes, 39% perhaps I need to learn more, and 45% no.
right. Qualifications to become a cardiologist. First, you are a physician, then you do a residency. First you go to medical school, then you do a residency, then you do a fellowship. So like a neurosurgeon or like a radiologist, a significantly longer runway to take off for, actually doing your chosen career. But again, a very worthy occupation. Joe, thank you very much. It was a great presentation. I just want to remember those of you who are on the meeting tonight. Next week, we're off. See you week after next. Have a great evening, everybody. Good night.
Thank you.